Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It's hard to believe that we are celebrating our 10th anniversary of Health Matters radio program. We are planning some special shows to celebrate the milestone, so we hope you'll stay tuned. Let us begin today by thanking our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, our socially distant producer, J.D. DeAngelis. Joining me is Brad White, a compounding pharmacist, and our very special guest, Dr. Meghan Nein, board-certified anesthesiologist with Omni Orthopedics. Good morning, Dr. Nein, and welcome to the show. We're very happy to have you on the show, by the way.
Good morning. Thank you so much for having me.
Dr. Nein is the only physician who has worked on me that's been on the show. So, and we'll talk about that a little bit later. So,
all right. Well, we all experience pain to a greater or lesser degree at various points of our lives. It's said that pain is the most common reason patients seek medical attention. Each of us perceives a given amount of pain stimulus in our own unique manner, and the intensity of the response to pain stimulus is largely subjective, which means the severity of that pain is most accurately defined by the person that has the pain rather than someone observing it. So today we're going to discuss how to help patients return to a level of activity and quality of life through an effective multidisciplinary approach that includes an array of procedures, some of which are not offered at all traditional practices. So today's program will also be available on our podcast. Look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So Dr. Nein, welcome to the show again. Tell us a little bit about yourself and your background and your training.
Yeah, so I originally did medical school in Chicago, and then I did an internship in general surgery over at UPMC in Pittsburgh. After that, I did my residency in anesthesia. And then I did a fellowship year at Cleveland Clinic that really primarily focused on just pain management. And then after that, that's when I joined Omni, and I've been there ever since.
Great. Omni, by the way, folks, is a great place. I've been to all of their buildings, okay? And as I mentioned in the opening, Dr. Nein did a treatment on me, which she did yell at me once, but that was because I was moving, and I had to sit still or lay still. So, but be that may, she's great. She's a great doctor. So when she suggested to me that she was going to do some injections in my spine, I thought, wait a minute, I don't know how I feel about this or not, but I thought it was relatively painless, and it really helped me a lot. So Dr. Nein shared a bit about what pain is, but share some details on pain, what it is, and how to fix a patient's quality of life.
Yeah, so pain is such a subjective thing. I think that's what makes pain management the hardest, is that I can't physically feel what the patient is feeling. And so we have to try to work hard to get that information that we need in order to treat somebody's pain accurately. So that's asking questions through, is something feeling more like a burning sensation, or something feeling more like an aching sensation? And that's all, information, part of the overall, broad category of pain. It can be something that is sharp, aching. It can happen once a day. It can happen once a month. All of those various things go into something that's painful for somebody. And so it's such a subjective thing that it can be really difficult to assess sometimes.
So you sort of mentioned what kind of pain you deal with, but what all do you see in pain management, and where do you go with some of this stuff?
So
I think of as an anesthesiologist, as someone who in the surgery suite and while they're doing a bypass surgery or whatever for hours. That is not the case with you, the way I see it.
Yeah. So this is all outpatient stuff. So what we do is we treat really an array of all types of pain, literally from head to toe. So I'll see things either, migraines or facial pain when somebody has something like neuralgia, when they have, severe facial, related pain, or chest pain. If somebody's had a surgery in the past and they've had surgery in the chest area and now they have resultant pain, the surgeon comes back and says, well, what I did was okay for surgery. I'm not sure what else can help you. that's when you would, think about seeing pain management. And so we really see everything toe. Um, and that's, things that are procedure related, could be things that are arthritic related, nerve related, all kinds of things.
So I suppose you see people of all ages.
Well, I primarily see those 18 and above. Um, for the pediatric population, usually I would send to a pediatric specialist. So if somebody's younger, say for instance, younger than 12 or so, I would be a pediatric specialist in that case.
Interesting. Go ahead, Brad.
Okay, Dr. Nein, what are some common misconceptions about pain management?
Oh, so people often say that they were hesitant to come to pain management because they thought that we were just going to dish out medications or try to force them to take some type of medication to feel better. Certainly, medications are a part of it, but it's not the only method of pain management. So, for instance, the way that I was trained, I try to avoid medications if possible, given a lot of the potential side effects that can come from them. And so I primarily try to focus on more of an interventional aspect, as Paul was talking about injections and things like that, in order to get people to feel better. So a lot of people don't even realize that that exists, that there may be some type of injection that they could have done to relieve their pain. And so a lot of people, miss out on coming to pain management because they're worried that all we're going to want to do is put them on medications.
I thought that. I did.
All right. How will I know, or how will a patient know that it's time to see a pain management specialist?
If your symptoms are starting to affect your daily life or are preventing you from functioning in some specific way, that would be a good time to go, because you want to have a good quality of life. You want to be able to take your dog for a walk around the block, or go see friends or have dinner with somebody without having to worry about standing up. And so if it's something, some type of symptom is starting to affect your daily life function, that would be the appropriate time to go.
Okay. So how about this? What is the process like to get in to see a pain management physician?
So it's pretty easy, specifically for our office. A lot of times you don't even need a referral. You can just call the office and make the appointment. And then you just let us know if you've ever seen somebody else for this pain before, so that we can get accurate records and sure we know all of your history and we're not missing anything, or don't want to repeat anything anybody else has ever done for you. So a lot of times we'll try to obtain any outside records that you may have, and then we see you for a consultation. And during that consultation, we talk about what your pain is like, what's been happening, what it feels like, what you've done for it already. Then a lot of times, depending on what that pain is or where it's located, we may get some type of imaging, like an X-ray or an MRI, to kind of look into it further, so we can be sure that we're diagnosing the right thing.
So how about expectations? So what should a patient plan for, or be, what would you like to go through their head when they come see a pain management doctor versus maybe what they're fearing?
I would say just to have an open mind about what types of treatments exist. So quite frequently, someone hears injection and they kind of cower and they say, no, I couldn't even imagine somebody doing an injection. A lot of times it's much more pain-free than what they think, and it may be a better option for them long term than what is necessarily placing them on a medication or something like that. And so I would say if people could have an open mind about the different types of treatments that exist, that would be the best, and usually those are the people who end up doing the best with their care.
Okay, thank you.
Well, why don't we take a break here, Brad? You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing pain management with Dr. Meghan Nein from Omni Orthopedics. So, doctor, how did your training in anesthesia help you become a pain management physician?
Well, when you think about it, anesthesia is pain management.
Well, yeah, but you put them out. I guess you're right.
Somebody's going through the ultimate thing. You're trying to make sure that they don't feel any of it. So anesthesia really helped me a lot because it taught me not only about common medications and that aspect of things, but the skills that I developed from a technical aspect of performing procedures. So in anesthesia, for instance, you use an ultrasound so often. You use it for placing, IVs, or, doing nerve blocks before surgeries or things like that. And so skill wise, it really helped me develop those skills. And anatomy wise, you have to know your anatomy as an anesthesiologist about what nerves go where and what
Yeah.
you can do to them and all those types of things. So it was pretty paramount in my training, I think.
So, what other conditions are you treating at the office?
So at our office in general, we treat anything really orthopedic. So we've got, spine surgeons, sports medicine, total joints, all of those types of things. We also have a psychologist that works for us, and he's very good, especially from a pain management standpoint, because he oftentimes will help intervene with those who might have, common problems both mentally and physically that are affecting their painful conditions. And then we have a physiatrist as well. So we see a whole array of things.
So how does obesity and smoking affect pain conditions?
Significantly.
Uh,
Obesity
Excuse me.
is a big problem when it comes to pain management, and in particular spine pain and joint pain. What people don't realize is that they're putting so much extra weight onto their spine and onto their knees and their hips and their joints, and over time that causes a very significant amount of
Mm.
degeneration. And that the faster you degenerate those joints in your back, the more and more pain that you'll have. And so, a lot of times, strengthening the muscles, so for instance, your core muscles and your back muscles to support your spine, makes all the difference in terms of pain relief. So, I always tell people, I can help you try to get pain relief right now, but unless we correct what one of the major problems is causing the pain is going to keep coming back again. And so I try to help people in the interim get their pain relief, but then long term we try to make goals that their pain relief is long lasting. In terms of smoking, again, a lot of people don't realize that smoking causes kind of this diffuse inflammation throughout your body. And there's a lot of ties between smoking and chronic pain. In particular, smoking can lead to a lot of chronic disc degeneration in people's spines. And so then their discs are more prone to bulging out or herniating or becoming more painful. And so I strongly recommend, when I find out if people are smoking, if they can at least cut back, if not stop smoking, because it'll benefit them long term.
So you say that it affects the discs or the
Yes.
nicotine, and it's nicotine. Is that what we got going here?
Yeah, essentially what happens is that your discs already get only a small amount of blood flow. And a lot of times with smoking, what'll happen is your blood vessels will kind of clamp down even more, and then they get less. And so that's less nutrients and less, things that they need in order to be healthy. And so a lot of times people will have a lot of, degenerative discs in their back when they're chronic smokers.
So how about different types of injections and procedures do you perform? In fact, what is the name of the treatment that I had on my spine? Infusion or something? Or
You had a cervical epidural done. And
okay,
so that was meant to treat, nerve related pain. So epidurals are frequently done, and they can be done in the neck or the middle of your back or your lower back. They're probably the most common procedure that we do to treat spine pain. And they're primarily done when somebody has a nerve that's being pinched, for lack of a better word.
Hmm.
And it's meant to help alleviate those symptoms so that it's not quite as painful with that nerve being pinched there. But overall, we have an injection for most things.
Hmm.
Like I said, even for things like migraines, we'll do Botox injections for migraines, or for facial pain. Sometimes we'll do injections for trigeminal neuralgia or
Hmm.
something like that. Even for things, if somebody breaks a rib, there's a nerve block that exists for that, because breaking a rib is very, very painful.
Yeah.
And people don't realize that you don't just have to take medication for that, that there is a pretty simple and fast nerve block that we can do for that,
Hmm.
that really quickly gets you some pain relief. And so we do everything from head to toe, various knee injections, um, all kinds of stuff.
There was a glucosamine in the hip or knee or something. Has that kind of gone away, or
There is still what we call visco supplementation. So, or commonly people will call them gel injections that
yeah,
they'll.
okay.
That's primarily done in the knees for when somebody has bad osteoarthritis. So we do those as well. Yeah, you don't typically do those though for the hip or the shoulder.
Okay. Now, would you, in that sort of a gel product, would there be an anesthesia, an anesthetic in there of sorts? Pain
Um,
reliever of sorts?
There's when you do those gel injections, there's no anesthetic in there. So I'll anesthetize the skin on the outside so that somebody, it doesn't feel quite, as uncomfortable when you try to put the gel in. So initially you'll put some topical medication on there to anesthetize the skin. But then after that, you don't really feel anything besides pressure as that gel
Mhm.
goes in there. And then that gel helps sort of almost kind of, for lack of a better term, kind of build up, the cartilage, or to make the person feel better.
Brad and I, as pharmacists, have seen over the years a tremendous amount of um, narcotic pain relief. And what's your opinion on opioids, and how
Yeah.
drastic, I guess, does it have to be to prescribe them?
Yeah. So opioids certainly have their place. So I'm not a person that would ever say absolutely none, that nobody can, ever be prescribed opioids, but they're not my first line treatment. And in fact, that's usually one of my last, defenses would be an opioid medication, because typically I find that people do much better with injections, or much better with other medications that are more specific to their problem. So, opioids are sort of just a generalized pain medication, whereas other medications might be more direct for the problem that they have. And those more direct medications will commonly give more relief and are better to take, long term than what opioids are. So that's a conversation that I have with a lot of patients, is that if we're thinking longevity, opioids sometimes may work in the short term, for just a short while, but they're not a very good long term option if we can avoid them.
Sure. Okay, doctors, time for the news, bottom of the hour. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. I have a lot more to cover this morning with Dr. Nein, so let's get back to the show.
All right, doctor, I am guessing that you are in a very interesting practice and section of medicine, because there's a lot of new technology available to you for pain management. Do you care to share some of your favorites?
Yeah. So we've actually, even within the past, 5 years or so, had some exciting newer types of technology that are out now that have had a lot of advancements, and I've seen a lot of benefit from. So, for instance, one of them is called peripheral nerve stimulation. And it's something that we have available that now we can treat people. For instance, somebody would be a good candidate if they've had shoulder surgery and are, no longer able to have more surgeries and still have pain. Or if somebody is too young for shoulder surgery. So, somebody needs a shoulder replacement, but they're too young to have it replaced and are still in pain. And there's, not much more they can do about it. what we do is we try to stimulate the nerves that go to that joint and ultimately provide longer term pain relief for them until they're able to undergo that process. So it's a very minimally invasive technique that I've seen a lot of advancements with, and I've seen a lot of success with. So currently, we're using it for major joint pain, such as the knee, the shoulder. I use it for lower back pain as well. We also use it for other conditions. For instance, if somebody has a chronic nerve injury of some kind, we use it for that as well to treat the pain associated with those nerve injuries. And so that's been within just the past a couple years, really seen advancements in that. We've also seen a lot of advancements in spinal cord stimulation. So, spinal cord stimulation is something that we do often for people who either are not good candidates for surgery of their back or have tried surgery and surgery wasn't helpful, or simply don't want surgery. A lot of times it's a more advanced technique. If the injections aren't helping or medications aren't helping, it's a more advanced type of process and technique that we use to try to get people relief.
What about, do you use some other modalities at your practice? Any massage therapy or acupuncture, or, how can you use some other maybe non-traditional things in your practice?
Yeah. So we don't do the actual acupuncture or massage therapy at our practice, but it is something that I will recommend when appropriate for people, especially those who have a lot of types of, muscular type pain. In fact, our physical therapy department does something that's called dry needling. And that's something that doesn't involve medications or anything like that, but is another technique and way to get relief of muscular pain and muscular spasms, where you don't have to go through, medication or anything else. Sometimes we'll also, I'll talk to patients about more holistic things such as, CBD oil or use of turmeric as a more natural anti-inflammatory rather than the prescription anti-inflammatories that people have. So yeah, we do recommend that from time to time.
I want to come back to your physical therapy because I'm sure that's pivotal in helping people, and I'm confident you have comments on that. But you've mentioned back pain a couple times, and in the pharmacy, we hear an awful lot of patients who come in and have some level of back pain, whether it's from an injury or arthritis. How important is our posture to overall back pain or magnification of that problem? Is that a fair question?
Yeah, no, I think that it's a really important thing. So a lot of our posture depends on our core. And you need to have good core strength to sit up straight and to maintain, your posture. You need solid core strength. And that alone is paramount to having good spine health. So I usually tell people you can kind of think of your spine like a concrete column. Let's say you have a concrete column outside and it's just by itself. When the wind blows and that column sways, all of the weight comes down on the bottom of that column, and the bottom of that column takes so much wear and tear. Now, if you add support beams to the column and the wind starts blowing, then a lot of that weight gets dispersed to the support beams, and there's much less weight on the bottom of the column, and it doesn't wear down as quickly. So, our body's support beams are our core strength and our back strength. And so, the more you support your spine with those muscles, the less degeneration and the less impact that you're having on your spine. And overall, you have better spine health.
Is there anything I can do at home to help with back pain?
Certainly, there are home exercises that you can do. So a lot of times there's various yoga positions or stretches or things like that you could do on a daily basis that really focus on developing that good core strength that I was talking about. That's probably one of the biggest things that you could do. Also, maintaining a healthy body weight and smoking cessation if you are a smoker. Those are all things that you could work on in order to maintain good spine health.
I'm sure we could probably talk about diet too, but that's probably for another program, right? So
There are
I
inflammatory diets that exist, but I'll tell you, they're very hard. Most people, when I show them the anti-inflammatory diet, they basically laugh at me and they say, I can't do that. And I can't blame them. It's removing a lot of stuff from your diet, good stuff like chocolate.
yeah.
I thought
So
dark chocolate. I thought dark chocolate
wait,
was good for you. What happened here?
Diet removes everything fun. It gets rid of pasta, carbs, and so I don't blame anybody. It's a tough diet.
Let's
yeah.
see. Okay.
What about your physical therapy team? How can they be an asset to helping someone with spine pain?
Oh, physical therapy is extremely important. Once again, I'm always looking for ways for people to be able to achieve pain relief without having to do some type of, medication or medicated, way. And they're very, very good at that, especially because some of the injections or things that we do, like I mentioned, kind of and touched on earlier, may help you with your pain relief right now. But long term, we need to make changes in order to prevent the pain from coming back again. And those changes are all about developing good strength surrounding your joint, good core strength, back strength. And so physical therapy really works with people to develop those things so that long term we can try to prevent that pain from coming back again.
Can we jump back to topicals again for a minute? We
Mhm.
got so many topicals in the drugstore. It's really difficult to help people decide what they want to use. Okay, so we got cooling gels, and we got rubefacient, and we got lidocaine patches, and we got lidocaine roll-ons, and plus CBD lotions, CBD capsules. It's not a topical item, but and suggested to me was this isn't necessarily a drugstore topical, but 20 minutes on with ice and 20 minutes on with heat. What's the deal here? What do you really think works?
Well, I think it depends on what the painful condition is. So, for instance, if somebody has a painful joint, if they have a lot of knee arthritis, then you want to look for something that has sort of an anti-inflammatory effect to it. So that would be something like Voltaren cream or diclofenac gel,
Hmm.
which is inherently an anti-inflammatory. Now, if you're having something that's more nerve related, for instance, people who have peripheral neuropathy and they feel feet sort of have that burning sensation, then you want something that's going to more try to numb that sensation. So something more like lidocaine. So I think it all depends on what the painful condition is, and then you can try to base it upon that.
Do you treat peripheral neuropathy with any sort of a um, something at Omni, some sort of treatment?
Yeah. So with peripheral neuropathy, usually I start with the most conservative or minimally invasive approach, which is topical medications. And in fact, a lot of times that involves a compounded cream. So, as you guys know, a cream that has to be put together at a specialty pharmacy. And
Now,
so,
are you using our specialty pharmacy?
do it.
Go
And
ahead.
so
I'm sorry.
kind of a little recipe that I use for that. So that's how I start with it. And then from there, you could consider things like various medications, or now there just recently was approved a form of spinal cord stimulation that was finally approved to treat painful peripheral neuropathy. And so there is a procedure now that can be done to try to help it, and that was just recently because previously insurance companies wouldn't approve the procedure to be done even though we knew it helped, and so nobody could pay for it because it's far too expensive. But now it finally has insurance coverage, and so now we can start using it, which will be great.
What do you call it? I mean, what is the term
the,
again for?
the procedure is called spinal cord stimulation,
Okay.
and essentially it's a procedure that we do within your back actually to try to almost sort of jumble the signals of pain so that you don't feel as much pain coming from those nerves in your feet.
Sort of like a Thames unit, or
Yeah, except it's
sort of.
unit is on the outside. And so the TENS unit is something that you do on the outside. And this is something that you put all internally that's inside. But it's got a similar idea. So for instance, the reason a TENS unit works is because our body has a hard time sensing more than one thing at a time. So
Okay.
a tingling sensation from the TENS unit, it's not sensing as much painful, sensations from your nerves. And so the idea behind it is the same, except TENS unit you can't wear on you all the time and take it with you everywhere. So this would be something more internal to try to help with it.
Okay. Final breaks here, doctor. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us today. And let's get back to the last segment of the show. If I may, can we talk a little bit about Omni? And I know you have 3 buildings or 3 locations, actually, and I've been in every one of them, I think, over the years. And I happen to think that Omni is a very fine operation, efficient. The people are very courteous. And I guess I've only seen you and one other person some time in the past, but tell us about Omni, what all they do and where their locations are and how many doctors you have and the whole story, if you would.
Yeah, absolutely. So we have multiple locations. We have a location in Dover. We have a location in Canton, and we have a location now in Alliance as well. So those are the offices in which somebody can come in and have a consultation and talk to us. In each of the offices, offer physical therapy as well. And then we also have our own surgery center. So our surgery center is a separate location. It's called Oasis. It's on the corner of Whipple and Portage. And that's where we do, or at least try to do, as many procedures and surgeries as possible. Especially nowadays in the times of COVID and all the exposures and things that you can get within the hospital system. We really try to do as much as we can in the surgery center to keep people as isolated and safe as possible. So we have surgeons for spine and shoulder and hip and knee, foot and ankle. So we have sports medicine specialists. So frequently, our physicians will help with local sports teams and that type of thing. We have a physiatrist who also, practices similarly. And we have a psychologist there as well.
Interesting. I remember the days when you went into an orthopedic surgeon's office and there were about 500 people sitting in there waiting to see the doctor. I really appreciate the efficiency of Omni. And, you walk in the door, they greet you, they're nice, they're kind, everybody, okay, right away. Everything happens. Everything happens. So
we've been very excited over the past year and even maybe longer than a year. We've been doing what we call our express clinic as well. So that if people feel that their pain or their joint or something has happened and they need to be seen immediately, if there's not a doctor that's immediately available, they come to our express clinic and get evaluated and treated there. And to be honest, I think that it's been a great thing because a lot of times if you go to a stat care or the emergency room, they kind of just play the middleman. They'll take an x-ray and then, give you a little bit of pain medication and then say, wait for an orthopedic surgeon to see you.
Correct.
But express clinic, you can come in and get straight to the person who you need to be seeing right away. And so
hey, I had a very short wait every time I've been there waiting. Okay. And I was listening to this one guy who came in for the one time I was in there short. Guy walks in the door, goes over to the check-in. Yes, how are you? All that kind of stuff. Gathers in for, when was the last time you were here? Well, about 2 years ago. And he said, I'm having a problem with the same problem I had 2 years ago. You guys took him right away. I just couldn't believe it. So, and they looked a little, they did a little record lookup and that sort of thing. You still got the same insurance, all that kind of stuff. And I thought that was really fantastic.
Well, we worked hard at that, so I appreciate that.
Well, I think we're running pretty close on time, Brad. What do you think?
Yeah, we got about 2 minutes left. Do you want to mention anything you're excited about that you're working on in your practice or up and coming technology or anything like that?
So I would say the biggest thing would probably be that peripheral nerve stimulation that I mentioned previously. That's been an upcoming thing within the past year and a half or so that we've now been starting to offer for people, and I think that it's made a really big difference in terms of back pain and various joint pains that we've been treating. And so I've been very excited for that.
How about you speak to the patient that's listening right now that really needs to see a specialist like yourself or a pain management
Mhm.
specialist, and how to help them reconcile with their fear of making that leap?
Yeah, I say it doesn't hurt to just talk to a specialist. You're never forced to do anything, but at least it gives you the education about what it is that's available to you. And that way, you're not fearing the unknown, and you have an idea as to what you can be offered or what you could try. And you can always go home and think about your options. You never have to make a decision on the spot, or any decision at all. You can go home and choose not to do it at all if you don't want to, but at least you then know the options that are available to you.
Very interesting. Thank you very much, Dr. Meghan Nein. We enjoyed talking with you, and I enjoyed, not enjoyed, but you've really taken good care of me, which I really appreciate. Okay. So I can't say that often enough. Anesthesiologist with Omni Orthopedics. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Studio Arts and Glass, and of course, Cleveland Clinic Mercy Medical Center, and our technical producer, JD DeAndos. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. We'll see you right here next Friday on News Talk 1480 WHBC.